Well, no one likes to talk about cancer, but it's always a good idea to consider the latest technology for cancer treatments. Dr. Shannon Cox is a board-certified radiation oncologist with Austin CyberKnife, and he's here to talk about Neck and Head Cancer Awareness Month, which is coming up in April. Good morning.
Good morning. Good morning.
Yeah, tell me a little bit about the cancers that are considered head and neck cancers.
Well, basically, the most common are involving the base of tongue, tonsil, larynx. They're usually smoking related traditionally, but now we do have patients that have never smoked that have the HPV virus, which is kind of interesting that we didn't have those. So we're getting much younger, affected with much younger patients. And
I'm surprised to hear that.
yeah.
Tell me a little bit then about the signs and symptoms, because it sounds like you're covering lots of different areas, right? So are the signs and symptoms the same, or are they different per cancer?
Well, one thing good about head and neck cancer, it usually shows up earlier because it's on the tongue or mouth. People get a sore throat, or they're shaving, they feel a lump in their neck. Unlike abdominal tumors that may be pancreas that are delayed because unfortunately they're delayed until they're maybe more advanced. But head and neck generally show up earlier, so we get earlier diagnosis, and that leads to better cure rates. So typically sore throat or a lump on the throat, feeling a lump on your neck, that kind of thing. So.
Would you feel anything like feverish, or would it just be noticing a lump?
Yeah, generally just a lump or a mass or a sore throat, but not any fever or chills or shortness of breath generally.
Okay.
And sometimes hoarseness for larynx cancer, if somebody is chronically hoarse, that's another one.
Okay. That's an important sign. Okay.
Yeah.
So with all of these different types, how would you treat head and neck cancers?
It's basically primarily a surgical disease, in that generally they go through a head and neck surgeon, and if it's out of the realm of what they can remove, then radiation comes in. And it's really a multimodality. It's a combination of surgery, radiation, chemo, with probably surgery and radiation being the top, the most important. So it's really a combination of all three of those. And in CyberKnife, we use it either for a boost or for recurrent disease. CyberKnife is absolutely essential if it's recurrent head and neck cancer.
And tell me a little bit more about Austin CyberKnife. How does it help with cancer?
Yeah, well, it's very, very focused. It allows you to just zero in on the tumor with much less morbidity, less collateral damage than ever before, and give a higher dose to the tumor and a lower dose to the surrounding critical structures.
And the recovery time's pretty good on it, right?
Yes, because it is so focused.
Yeah,
it's much better.
Well, and tell me a little bit more about where we can go to learn more about this. Maybe if somebody's tuning in today and they think, wow, I've never heard of this before.
Well, I think resources like the American Cancer Society are great, are online. Our group has, have a website and has links to it, Austin Cancer Centers. CyberKnife has links to, so you usually go to those and you find a link, or like American Cancer Society has really good resources.
Okay, good to know. Dr. Shannon Cox, thanks so much for being with us today.
Thank you.
Austin CyberKnife is located on I-35 near the Del Seaton Medical Center at the University of Texas. To learn a little bit more about what they can offer you, call them at 512-324-8060 or go to austincyberknife.com.